I certainly didn't plan to do audiology from the start. I remember at school I didn't know what I wanted to do, so I chose the sciences and I did the sciences, and then ended up I went to university, chose to do biology at university. I remember just being really into primates, and so I used to choose all the modules that were to do with like monkey behaviours and that sort of thing, but then when it came down to it, actually getting a job working with monkeys, it wasn't happening. And so I would just look through like a career guide thing, and audiology was right near the start, beginning with A. And my mum is deaf as well, so maybe that made me think a bit more about it. And then the more I looked into it, the more intrigued I was, and just went for it. That's how it happened. So I'd already done a degree in biology, and then I used that degree then to help me get onto a master's course, and it was a master's in audiology. I did it down in Southampton. And yeah, it was like a year's course in audiology. It was pretty intensive, but it was really good fun as well. It was a really good group of people on there. When I did the course, it was you did a year at university, and then you got a placement in a hospital, local hospital, and so then I was working in a hospital, and you're getting paid at the time while you're training. It was good, yeah. My job as a clinical scientist, I see a full range of different patients. So the patient comes in, you sit them down on a chair, make them feel at ease. Most important thing to do is have a look in their ear first of all, make sure the eardrums look healthy and that there's no obstruction in the ear, wax obviously. And if everything is clear and there's no significant obstruction, we sit them down, headphones on, they hold a button, and then I'll give them some instructions that you're going to hear a series of sounds. They start quite loud and then get quieter and quieter. Every time you hear the sound, you press the button, and that's how it works. And when we test the hearing, we're not just testing it one sound in each ear. It's a range of frequencies, so you can imagine that almost like keys in a piano. So I start low tone, dung dung, and then I test higher and higher in pitch, different tones, and then at each pitch, the patient may have a hearing loss, maybe in the higher frequencies, but the low frequencies may still be normal, and that's quite a common thing. And then each patient will have a different configuration of hearing loss. And then when we've completed the hearing test, we'll discuss the results with the patient, decide how we want to move forward. Some patients may be suitable for a hearing aid, and we now fit digital hearing aids to all patients who require them. And the digital hearing aid you could program the settings in the hearing aid to suit an individual patient. So they are absolutely excellent devices these days, and the technology is just advancing all the time. So it's a very fast-moving career to be in.